Hi nurses. So today's video is going to be the lecture on acid-base balance. So this is one of the most important lectures for NCLEX and even otherwise for the nursing students as well, not just for the NCLEX. So this is a part one of the video where I'm going to explain about metabolic acidosis and metabolic alkalosis. Before we dive into this topic further, we need to understand about the arterial blood gases or ABG values. ABG values are something which enables you to look into the patient's reports after taking the lab samples for the arterial blood gas analysis, where you identify what kind of problem does the patient has, whether he has metabolic acidosis or alkalosis, or is it respiratory problem. So first of all, there are four indicators of ABG values, or in ABG analysis, we look at the four parameters. This is pH, HCO₃, which is also known as base or bicarbonate, partial pressure of oxygen, and partial pressure of carbon dioxide. So we have these four values to which we look at, and then we identify whether or not the patient has metabolic problem or he has respiratory problems. Before I dive into further, we need to also understand the fact that decrease in the pH. So pH is what? pH is something which helps us to identify whether the patient has presence of acid or so our blood is kind of neutral, right? Neutral means from the scale of 0 to 10. If we see the number 7 identifies a neutral thing. So 7 being the neutral thing. Less than 7, anything less than 7 is acidotic, and anything above 7 is alkalosis, right? So when we talk about acidosis on that scale of 0 to 10, so normally we have a pH strip which identifies whether or not this substance is acidic or basic. But in this case, we take the lab draws, and from the ABG analysis, we look whether or not the patient has a problem of acidosis or alkalosis. So whenever the rate goes to less than 7, that is acidosis, and whenever we have a level above 7 on a scale of 0 to 10, that is what we call alkalosis. But in human body, the normal pH stands 7.35 to 7.45. So means anything less than 7.35 is acidosis, and anything above 7.45 is alkalosis. So alkalosis means the basic condition, the base has increased in the body. Acidosis means acidic condition, the acid has increased in the body. This is why pH has reduced. So pH is something which will tell you about acidosis or alkalosis, whether it is respiratory or it is metabolic, that doesn't matter. Acidosis means everywhere the pH is going to be less than 7.35. Alkalosis means the pH is going to be above 7.45. Now, furthermore, you need to understand the part of metabolic. Metabolic means related to kidney problems, or the patient is having any kind of kidney disease. We have two systems in our body, the renal system and the respiratory system. So the lungs and the kidneys, these are the something which are acting as a buffer system. They maintain the acid-base balance in the body. So if one gets damaged, the other one is there to rescue the person. So in case if the patient is having metabolic problem, that means his or her kidneys are affected. So in that case, who will compensate? Lungs will compensate. Similarly, if we're talking about respiratory, that means the lungs are affected, and now the kidneys will compensate for this patient, because out of the two, one would be compensating if other one is getting damaged. So here in the metabolic, kidney is affected, so the patient has a kidney problem. The lungs are going to do the job. They're going to compensate for this patient. Now, if you have a knowledge of these things, it will be easy for you to understand about metabolic acidosis and alkalosis. Now, pay attention here. So in acidosis, like we said, everywhere where the pH decreases is acidosis, and when the pH increases is alkalosis. So here the pH decreases, this is acidosis. The pH increases, alkalosis. So this is very easy to identify. Anything less than 7.35, acidotic. Anything beyond 7.45, alkalosis. You can call it alkalosis, you can call it increase in the base concentration, whatever you want to. So now for the metabolic problem, since metabolic is related to the kidneys, so in case of kidneys, we will forget about these two gases, because metabolic is related to the kidney problem, and we will no longer look at the gases which are actually made by the lungs and not the kidneys. So now when these two are eliminated, we just have left pH and HCO3. So since we are left with these two, we will only and only look at the concentration of pH and HCO3 if we are talking about acidotic conditions, and again pH and HCO3 even for alkalosis as well. So now the pH will decrease in case of acidosis and bicarbonate, which is base, and obviously when you have acid and base as balanced, and in case of acidosis the acid will be made more, right, then the base, it is going to decrease. And another reason, think about it, like if base will increase, obviously the condition will no longer be acidotic, it will be alkalotic or alkalosis. So here the base will decrease, and with the pH the base is decreasing. On the other hand side, with the pH the base is increasing, so the base is HCO3 and this condition is alkalosis, which means basic. So obviously if the base will increase, the blood will be having more of alkalosis and the patient will have metabolic alkalosis. So the cause for metabolic reasons is the kidney problem, and in case of acidosis we have decrease in pH level and decrease in base, which is bicarbonate or HCO3. In case of alkalosis, the pH will increase because the conditions are basic here, and the base will obviously increase. Now let's think about hyperventilation and hypoventilation. Why does the patient hyperventilates in case of acidosis, and why does he hypoventilates in case of alkalosis? So the thing is, when the kidneys are impacted or when the kidneys are affected, the lungs will compensate. And you need to know one thing, carbon dioxide inside our body makes acid. So in this condition, the acid is already being made inside the body, right? So the patient is already having acidotic conditions or acidosis or metabolic acidosis in the blood. Now, the body will try to do what? The kidneys are affected, the lungs are okay, the lungs will try to compensate. If the case is metabolic where the kidneys are impacted, the lungs will do the compensation now. So what are the lungs going to do? They are going to deal with the gases. So this patient is going to hyperventilate. Why? Because if he will hyperventilate, or if his respiratory rate will increase, or if his breathing pattern will increase, with that he's trying to remove more and more of carbon dioxide out of the body. The more carbon dioxide gets removed out of the body, the more less is available inside the body to make acid, because increased carbon dioxide inside the body will make acid inside the body. And if the body is, and if the lungs are trying to hyperventilate, or if the patient is breathing more, the carbon dioxide comes out of the body, and the less is available inside the body. The less carbon dioxide available, the less acid will be made. And when the acid was already high and the base was low, the less the acid will be made, it will start coming down to the level and almost equal to the basic. The condition of metabolic acidosis will resolve. So this is why the patient hyperventilates in case of acidosis. Now, why does the patient hypoventilates in case of alkalosis? The patient hypoventilates because the lungs are trying to compensate again for the kidney problem, and this time the lungs are trying to hold whatever carbon dioxide the body has inside the body, because higher the carbon dioxide concentration, more is the acid production. And here, because base is already very high, we have to increase the acid production so that they both can become balanced. So this is why the lungs are trying to compensate. The patient is hypoventilating, the lungs are retaining carbon dioxide back inside the body so that the problem of alkalosis can be balanced out by acid production, which will only occur if the patient has increased level of carbon dioxide inside the body. This was the simplest I can explain about acidosis and alkalosis. I hope this video was helpful. You can wait for the part 2 as well, because in the next part I will be discussing about respiratory alkalosis and acidosis. Thank you so much for watching. Also, if you like the video, please like, share and comment in the comment section below.